Okay. Good afternoon to all of you, and I warmly welcome all of you once again for the second session of celebrating the World Mental Health Day at Deep Haven Counseling. So today morning we went through some of our student presentations, and five groups of students presented their uh, uh, research interests and gave a few insights as to what they really prefer in the field of mental health. And then afterwards, we had a discussion with myself, Mr. Janaka, and Mr. Ali on some of the issues mental health professionals specifically face during this time. Now, in this specific session, what we'll be discussing is primarily what other professionals face during the times of COVID. Because what we have to understand is that we always talk about the frontline health workers, but apart from the frontline health workers, just like them, there's other groups as well who are taking major efforts to work with people and serve the community. So we invited today a group of experts to share their ideas and sentiments about how things progress at present in Sri Lanka pertaining to their vocations. So, the objective of this particular session in this coming 2 hours is to understand more about what exactly happens in their vocations and how exactly they are helping the community. So I am very happy to introduce today Mrs. Kaushali Amaradivakar, who's a psychotherapist and a creative therapist. And then we have Mrs. Yoga Ravi, who is a special needs teacher at Aditya International. And then we have Dr. Hajra Sadam, who's a clinical psychologist. And then we have Dr. Muru Veeratna, who is a doctor at Karapiti Teaching Hospital, and then we have Miss Rishni Karunanayaka, who's a tutor at the Public Health Laboratory. Sorry, she's a tutor and a public health laboratory technologist. So I am very happy to interact with all of you. So thank you for taking the time out of your busy schedule to share your learnings and the insights with us today. So it means a lot to all the participants here and also everyone who is interested in the field of mental health. So at Deep Haven Counseling, our objective is not just to run or provide counseling, but also to engage in key policy making and also, promoting research. So just to start this, let me first ask the first question. I would love to understand more about the particular vocations that all of you are in and what kind of changes that all of you have noticed during the last couple of years pertaining to mental health. අපි මම හිතුවා අපි මේක පටන් ගන්න කලින් අපි ටිකක් තේරුම් ගන්න ඕනේ කියලා අපේ කරන විවිධ රැකියාවල් වල ඉන්න කට්ටිය අපි එතකොට අපේ රැකියාවන් වල මොන වගේ වෙනස්කම් සිදු වෙලා තියෙන්නේ කියලා මේ කොවිඩ් තත්ත්වෙත් එක්ක මානසික දේවල් ගැන අපි හිතන්නේ යම් කිසි දුරකට දැන් නැඹුරුතාවයක් තියෙද කියන එක සම්බන්ධයෙන් මම දැනගන්න කැමතියි. So let me first ask this question from Ms. Kaushal. Would you like to add a bit on this? And you can actually introduce yourself first as well. So, yeah.
Thank you, Mr. Narayan, and a very good afternoon to all of you. It's indeed such a pleasure to have connected with all of you today, being in this panel and welcoming all the panelists on board as well. So I would like to just start off by telling a bit about myself. So in profession, I'm a psychotherapist, and I'm mostly engaged in education and also in the adolescent and the young adult engagement factor pertaining to teaching and learning. So I also work in the capacity of a lecturer and at the same time in the capacity of a student support wellbeing officer as well. So taking my experience as of now, I would like to take this time a little bit backwards, not really just to pandemic, right? I'm sure if we take our generations or maybe our parents' generations, the whole concept of mental well-being, it might have been there, but those words did not really come to play. So the major change as a mental health professional that I see as of today is the fact that we do have these three words in the discussion, right? And we do have these three words which are in discussion in different platforms, not only the education, not only in different professions, but even among parents. even among children and among any other generations. There's no barrier right now. So I see this is a very positive outcome that we are seeing today. That's the very first thing that I wanted to add up, because I remember me, growing up, we did not hear this, right? But now we talk about it. And most of us did not probably have like a career guidance in embarking in this profession, unless otherwise we knew there was a little bit of a passion inside us. So that's the very first observation that I make. And if we take the later changes within the last decade, I would really like to highlight the fact that we have also gone into a bit of an extra highlight into this mental health well-being, right? And my personal opinion is that maybe that has caused us to see this psychology in a different platform than seeing it within us. So that's the second observation that I'm making. We see psychology, we see mental well-being and mental health as a complete separate domain which exists beyond humans. We go through theories, we go through principles and try to figure out what can be done, whereas we tend to have forgotten that it lives within us. So that's the most two important observations that I would like to bring from the platform that I am engaged in, Mr. Narel.
Thank you very much, Kaushali. So we'll take that as a good introduction to our session. And with that, I would like to talk to Dr. Muru. Would you prefer to introduce yourself and maybe tell us a bit about how this has how the COVID and all these things have kind of affected your profession or your vocation?
Yes, Naren. Yes, nice seeing you. And well, of course, the most major change I'd say for my profession is the scrubs, because physically, because previously, as you would have always noticed, doctors used to be clad in office wear, but now we're clad in scrubs. So that's some change that happened mostly because of the pandemic, about 1.5 years since now, and now it's mostly mainstream. So physically speaking, I'd say this is one of the biggest changes we're having, and of course, the new highlight on hand care and hygiene. So that will be the most important thing. And pertaining to this session, of course, as far as mental health, I can say that there has been greater interest in both us health professionals, frontline workers, not only us, the nurses, the minor staff, the domestics, everyone, and of course, even among patients as well. So I think this pandemic, the lockdown, everything, and the COVID pandemic has, of course, made us, consider mental health in a much more serious manner. I mean, previously, if someone just came with some symptoms, such as, feeling a bit lethargic or feeling, just a bit less motivated and this and that, we would mostly go behind the medical causes for an evaluation. So something like hypothyroidism, that means you have less thyroxine in your body, okay? Or some other disease like diabetes maybe. But over here now, we tend to just ask about the patient. So what is your social, how's your social history? Do you live alone? Where are your, children? Or do they come to visit you often? And what have you been doing these previous days? And then we can just pick up. Sometimes we can find the elderly population, mostly, they're having less contact with their children. Either they are overseas somewhere, or maybe they just can't visit them because of travel restrictions and this and that. So we're seeing that some of these, features or clinical symptoms that are coming to us can be attributed to mental health. And we are giving them, I mean, previously, I'm not undermining anything, but previously we used to consider more medical causes. But now we tend to look at these aspects as well, the finer things of life, and we tend to evaluate them. And then when necessary, we can, of course, send them for specialist help as well. And for medical practitioners, of course, I think, because in a way, sometimes I think we are like, sponges, like we always absorb the negativity, because you come to a doctor mostly with a complaint. Either your head is aching, your back is aching or something, right? Cough or cold, anything. So in a way, sometimes the negativity for us even has a bit increased. So we are sponging up a lot. Patients are coming with a lot of complaints. Now, not only physical, with some even mental health issues as well. So we have to attend to them. We have to be a better sponge. We have to be a bigger sponge. Otherwise, if we fall down as well, we cannot cater to our patients in a proper manner. So in a way, medical practitioners now, they're thinking about many ways of relaxation, because when we work in the hospital with a lot of work and this and that, we go back home and we tend to, switch off a bit from our, on-call lives, just, relax, reflect, do some hobby, engage in some hobbies or some recreational activity. we tend to do that. So, and of course, another thing, important thing that this has brought is shifts. Because previously medical practitioners were mostly in shifts about 6 hours. Now I'm an intern, so I'm mostly on call 24 hours. But with my co-ed shows, I can, like sort of make it to something like a 12-hour shift. But with COVID, we are there's a limited number of staff, so we are pressurized to work more because more doctors were being taken into the COVID care. So general wards were having less and less more doctors. So I guess most medical practitioners could not stick to the classic 6-hour schedule. We had to extend our hours. So that means spending more time away from family and home, more time in the ward, more time attending patients. So in a way, I think this actually made us consider about the patient's mental health and our mental health as well. And as I said, it made us in a way to be a bigger sponge. So this actually made us think us in a different perspective, especially in mental health.
Yeah, thank you very much, Miru. I think that was a lovely introduction to your vocation. And, I especially like the fact that you told that you have become like the biggest sponge, which is pretty true because considering that you are in the front line. So sharing that insight with us is the start that we actually was, expecting. So thank you very much. And now I would like to, move towards Dr. Saddam. So would you like to explain a bit about your vocation and how the COVID has impacted your daily job and all?
Okay. Thank you, Saren. Hi, everyone. Good evening to all of you. My name is Hajira Saddam. I work as a clinical psychologist for Durdans, and I'm working as a consultant for nearly about 4 or 5 other organizations as well. And also, I'm a visiting lecturer, Columbia University visiting lecturer, and NIST field supervisor as well. So I've been in this field for nearly about 11 years. I generally see clinical patients, people who are suffering with mental disorders, and I'm a family therapist as well. So I work with courts. So I have been dealing with marital issues, couple therapy, and teenage child, almost like cholera. So thank you so much for inviting me for this event. And first of all, I would like to congratulate Deep Heaven Counseling Center for organizing such a wonderful event. I think it's the need of an hour. So definitely this mental health has been transformed over the last 70 to 15 years. I should completely agree with that, because when I started my career a long time ago, I remember that mental health mental health issues was a taboo. So none of them were accepting, and it was not an outspoken topic. But now it has actually, I could see that there's a shift in society's attitude. People are becoming more accepting, and people are becoming more acceptance of mental health disorders, and they're supporting people who are suffering with mental health disorders and issues. So that's a really good thing, and that's such a positive thing as well. I also feel like there's much more awareness in the society about mental health disorder, and we could see that a lot of people are getting involved and studying, and a lot of resources are available. There was a time that even certain mental health professionals like psychiatrists, they were resistant to work with the other mental health professionals, counselors, psychologists. But today, after this COVID, we could see we are working as a unit, and mental health professionals are much more being accepted in the society as well. And also, I would like to state that one major change of this society attitude needs to be highlighted, because there was a time that people were so hesitant to talk about mental health issues, and they were really reluctant, and they were so backward in the field of mental health. But today, Sri Lanka is in a very, very good state, because there are a lot of mental health professionals. When I started my career, there was only like six psychologists. I still remember 6 clinical psychologists, but today in the field there are so many people who are working and supporting the other members as well. So that's also another transformation. And also I would like to highlight that the mental disorders like anxiety, depression, and personality disorders, schizophrenia, everything is being accepted in the society. People are aware of the symptoms, people are aware of the issues, people are aware of the causes, and they're seeking for treatment. So a lot of people seek for treatment nowadays. Even I see like nearly, 50, 60 cases per week. I feel it's a good number because when I started my career, I just saw like, one patient per month. So it was a long time ago, 11 years ago. But now everything's been changed. It's because of the advancement of the technology, science and everything. So there's a major shift, and now people are communicating about this different specialties, therapies, counseling. So everything is being changed definitely drastically after this COVID-19. So I think it's a good thing, but still we need to work a lot with this in creating awareness. 82% of people believe that mental health is important in Sri Lanka. So that's also another good sign that they are giving more preference to mental health than physical health. But still, we need to work on it, and we need to promote more and create more awareness. That's my thought about the transformation. Thank you.
Thank you very much, Dr. Sadam. And with that, I want to also tell all the attendees that we have two other very interesting participants here as well, experts who are working in both education and also laboratory, technology. So let me first ask this question from Ms. Yoga. Could you tell us a bit about your job and how this COVID has impacted you throughout?
Good afternoon, everyone. It's my pleasure to take part in this event. First of all, I have to thank Deep Heaven Counseling to give a wonderful opportunity to share my experience. So let me introduce myself. Okay, I am Yoga Ravi, and then I started my career in 2007. And I worked in a small special needs institute, and then later on I had been working with children with autism, Down syndrome, and children with behavioral issues. Then I joined Alethea in 2013. And when I was joining, I worked with children with learning disabilities and dyslexic. So presently I'm working with learning disabilities. Most of them are learning disabilities. So when I was working with the children, I always focused on make them to work independently. That's my important thing. Then presently I'm working with children with ADHD also and ADD. So for past 2 years, last 2 years due to this pandemic situation, I have been doing online classes with our children. So as we all know, that working with special needs kids was a challenging one in school directly. So you can imagine my stress level when I have to start working with them through online. So every day before I start the class, we have to get prepared and to maintain my stress level. So however, there were good days and the bad days also. So some days I could not get their response. And then some days we had a poor connection problem. And then some days they were very playful. They don't know what to do. So then some days they were very, it's very difficult to get the attention also from them. So I knew that the parents were also watching and observing our sessions. So I need more patience to handle all these issues. So finally, somehow I managed to get their attention and made them to finish the task allocated for each day. So I always feel happy with the small progress in my childhood to get rid of my stress level. Otherwise, if I expect more from them, it's not good for my mental health also. So I want to maintain my mental health. So whatever the resources I'm getting, through that, I'm doing my level best these days.
Thank you. Thank you very much, Ms. Yoga. I think it's very enlightening to understand what exactly you do in your daily job. and also to understand how the existing COVID regulations and all that have impacted your job as well. Because as an educator, I understand it's very difficult to teach online, but that also with special education, students who require special education, that's a whole different ball game altogether. So thank you very much for giving us that introduction as we move forward in this Q&A. With that, ඒකත් එක්ක මම හිතුවා දැන් අපි මේක ලංකාවේ කීප තැනකින් බහුල කීප ප්‍රදේශයකින්ම කට්ටිය මේකට ජොයින් වෙන නිසා අපි සිංහල මාධ්‍යනුත් යම්කිසි තරමකට මේ දේ කතා කරන්න ඕනේ කියන එක. ඉතින් ඒකත් එක්ක මම කැමති මිස් රිෂ්ණිගෙන් අහන්න ඔයාලට පුළුවන් ද වගේ රැකියාව සම්බන්ධයෙන් අපිට පොඩි හැඳින්වීමක් එක්කම මේ COVID-19 එක්කව මේ නීති රෙගුලාසි මේ පද්ධතීන් වල වෙච්ච වෙනස්කම් එක්ක මේක ඔයාලට කොහොමද බලපෑවේ කියන එක සම්බන්ධව ඔයාලට පුළුවන් ද පොඩි පැහැදිලි කිරීමක් කරන්න.
Good afternoon හැමෝටම මම රිෂ්ණි කරුණානායක මම දැනට වැඩ කරන්නේ මහජන සෞඛ්‍ය රසායනාගාර ශිල්පී පුහුණු පාසලේ ආචාර්යවරියක් වශයෙන් ජාතික සෞඛ්‍ය විද්‍යාලයේ කළුතර. එතකොට අපි මහජන සෞඛ්‍ය රසායනාගාර ශිල්පීය පිළිබඳව ඩිප්ලෝමාවක් තමයි අපේ ස්ටුඩන්ට්ස් වලට දෙන්නේ. එතකොට මම ඒකේ මයික්‍රෝබයොලොජි සහ ලැබොරටරි මැනේජ්මන්ට් කියන්නේ ශුද්ධ ජීව විද්‍යාව සහ රසායනාගාර කළමනාකාරීත්වය රක්ත වේදය කියන සබ්ජෙක්ට්ස් තුන තමයි මේ ලෙක්චර්ස් කරන්නේ. එතකොට සයිකොලොජි කියන ෆීල්ඩ් එක මම ඇත්තටම සිලෙක්ට් කරගන්නේ මේ ළමයිත් එක්ක ප්‍රශ්න ගොඩක් ආපු නිසා. ඒ කියන්නේ අපි හිතමු බැච් එක ළමයි 60ක් හිටියා නම් 60 දෙනාට ප්‍රශ්න තියෙනවා 180ක් විතර. එක එකනා එක එක විදියයි. ඒකෙන්ද මම මේ සයිඩ් එකට එන්නේ ඇත්තටම මම සයන්ස් කරපු එක්කෙනෙක් වුණත් මේ ළමයින්ගේ තියෙන ප්‍රශ්න සහ එදිනෙදා අපි මුහුණ දෙන ගැටලු වලට උත්තර හොයන්න තමයි. එතකොට thank you very much deep heaven counseling මට මේ අවස්ථාව ලබා දුන්නට. ඒ වගේම තමයි සයම් ගෝල් කැම්පස් එකටත් මම ස්තුතිවන්ත වෙනවා. COVID situation එකත් එක්ක අපි ළමයි එක්ක ඩීල් කරන්න වෙන්නේ ඔන්ලයින් ඇත්තටම. එතකොට අපිට මම කරන්නේ ලැබොරටරි සයිඩ් එක. එතකොට මේකේ ප්‍රැක්ටිකල්ස් ගොඩක් තියෙනවා. ඇත්තම කිව්වොත් මේ ප්‍රැක්ටිකල්ස් කියන දේ ඔන්ලයින් කරන්න බෑ. එතකොට අපි ලෙක්චර්ස් කරනවා. නමුත් මේ 100%ක්ම අපේ එෆර්ට් එක ඇත්තටම වැඩක් නැති වෙනවා මේ ඔන්ලයින් ක්‍රමයක් එක්ක ප්‍රැක්ටිකල් කරන්න ගියොත්. ඒකත් එක්ක තියෙන ප්‍රශ්න තමයි අපි දැන් රියල් ලයිෆ් සිටුේෂන් එකේදී ළමයිත් එක්ක ඩීල් කරාට මෙතෙන්දී අපිට පේන්නේ නැහැ ඇත්තටම ළමයා මේ දේ ගන්නවද නැද්ද අපිට ඒක මෙෂර් කරගන්න විදියක් නැහැ. ඒ වගේ ගැටලු රාශියක් තියෙනවා. ඒ වගේම තමයි මේ අපේ සෞඛ්‍ය සේවකයෝ එන්න කොවිඩ් තත්ත්වෙත් එක්ක කොවිඩ් ආසාදනයට ලක් වෙනකොට අපිට අපේ ස්ටුඩන්ට්ස් ලවත් මේ රැපිඩ් පරීක්ෂණ සහ සාම්පල් ගන්න යවන්න සිද්ධ වුණා. එතකොට එයාලා අතරමඟදී තමයි මේගොල්ලෝ යවන්න සිද්ධ වුණේ. අතරම ගුවන් තොටුපොළ සහ ෆීල්ඩ් එකට අපේ ළමයිව ගෙහෙල්ලා මේ එයාලට ට්‍රේනින් එක ඇත්තටම පොඩි කාලයක් අපිට දෙන්න උනේ. ඊට පස්සේ එයාලව ගන්න වුණා මේ සෞඛ්‍ය සේවකයෝ නැති හින්දා එයාලා එන්න ලෙඩ වෙච්ච හින්දා මෙන්න මේ වැඩවලට. එතකොට ඒකත් එක්ක බැලුවාම කොවිඩ් තත්ත්වෙත් එක්ක මෙයාලා ෆීල්ඩ් එකට ගිහිල්ලා වැඩ කරත් අර සමහරක් වෙලාවට මිනිස්සුත් එක්ක වැඩ කරන්න ගියාම එයාලා ගොඩක් ප්‍රශ්න වලට යොමු වෙන්න සිද්ධ වුණා.
Thank you very much, Rishni. මම කැමති ඒකත් එක්ක දැන් කෙලින්ම එතනින් එහාට අපි ඊළඟ ප්‍රශ්නෙට ප්‍රවේශයක් ගන්න. So we'll start focusing on the second question that I want to ask from all of you, which is now all of us understand as of now, based on what we have shared, that all of us in our jobs, we have some inherent amount of stresses that we have to deal with. And this has been pretty much enhanced in a significant way during the last 1.5 years. So now what I would like to know is how exactly the specific regulatory bodies and other, agencies, government agencies have developed certain mechanisms to help your colleagues improve their mental health concerns. So I would like to first ask this from Dr. Sadam. What exactly is your take on this?
As a mental health practitioner, I feel that the mechanism which is being used in the workplace is not sufficient, because the workers were not given much importance, and they were not even their mental health was not given much importance, because we all are focusing on the physical side, and maintaining the regulations, norms, and everything in order to avoid the spread of COVID. But in the workplace, we generally see that the pressure is really high. And even the mental health practitioners, sometimes they are like fully packed with clients, and they are fully scheduled. Even they don't have time for themselves. Even I faced this issue for nearly about 1.5 years now, because I was continuously taking clients and continuously taking anxiety, seeing anxiety and depression patients. That made me so stressed out at one point, because I didn't get a break. In countries like Sri Lanka, India, especially in Asian countries, I have been in many Asian countries. I know in countries like Asian countries especially, they don't give much preference to the mental health of the practitioner. They focus on the client rather than the practitioner. So I think we need to use certain mechanism. We need to increase we need to give them more preference, the mental health of the mental health practitioner, by giving them a little bit of time, and giving them a little bit of space to overcome their stress. And sometimes, like, even if you take European countries, they work only for like 6 months, and they take vacation for nearly 2-3 months, and then they refresh, and they start back. But in Asian countries, especially in Sri Lanka and India, we see that they don't get that space, own time. So this is making them feel more frustrated and stressed out. To be honest, there was a time that I actually felt I had a burnout also, because I had to continuously take clients and take patients. There wasn't any break. So mechanism is very low. So what are the things that we can do is, we can actually give them vacations. We can have a morning routine where they refresh themselves, reflect, start off their setup or whatever with taking some meditation and doing some relaxation. In that way, it would definitely help them to cope with their stress better.
Thank you very much, Dr. Sada. And yes, what you're saying is very correct, because being a psychologist, I can understand that when you get a lot of clients and you are pretty much listening to negative stories and things that makes people really stressed out, and it really takes a toll the more we actually keep on listening, and even though we try to actually help. So I think that's a very valid point that you are raising. Now, with that, I would like to ask from Dr. Mio what he thinks about the same issue that we have been now discussing. Are there any mechanisms implemented in the hospital for this?
Yeah, as far as mechanisms implemented within the hospital, well, there's not much, of course. Socially, I work in Karapitia. So over here, there's nothing much for doctors, just go out and chillax and relax. True, we do have a doctor's canteen. But apart from that, our wards do have our own doctor's room where you can just have a sofa and just, kind of relax. But more than that, I guess the issues that came up with this is mostly traveling, I guess. Because some doctors work, though they are working over here in Karapitia, their family may be somewhere in Chilao or something, right? The extended working hours and everything means that sometimes if they used to visit their family every weekend, now they might be doing it once in 2 weeks, once in 3 weeks maybe. So it's taking a toll on them. And for that, of course, I guess the only better way of fixing things would be to make, proper roster maybe of the doctors to enable at least these people who travel to have some more flexible schedules. And of course, enrolling more doctors. But I'm just a bit, I'm not that much affected by this, stress and this and that, fortunately. But there are some people who are affected, of course. Some of my batchmates who work in some other hospitals, they've had some, burnouts, and they've been on leave for about 2 or 3 weeks even. So that on the other hand has made the other co-HOs work more hard. Because if you have 3 house officers to run a ward, then you end up with 2. So of course, your on-calls are, this nearly doubled, and everything, the workload is doubled. So that has been taking a toll mostly on the house officers, of course, because we are the first in line. We deal with all the types of patients, that they be mostly physical issues or even the occasional patient who has a mostly mental issue. So house officers are mostly in a burnout, and nothing much has been done. Of course, as the previous speaker mentioned very correctly, the country mostly focuses on the patient's well-being, mental well-being or physical well-being. Doctors, not so much. I'm not really pointing a big finger at it, but it would be nice if support was there for the people who need it. And another thing I like to highlight is the usage of psychologists, mostly psychologists, in managing patients, because from what I see, psychologists do have a very important role to play in the management of any patient. They'll be counseling or anything, even patients with anxiety. But over here, the culture is mostly to refer to a psychiatrist. But mostly, even if a patient is diagnosed with depression with all the clinical criteria, we would start on some, SSRI or something, and then make a referral. But I feel that there's less weight being placed on psychotherapy, and psychologist's role is quite less. And I think as much as for patients, even for the affected doctors or the other medical staff, we could use a lot more. Because over here in Karapiti, of course, I think there are 1 or 2 psychologists even. There's one attached to the university, as I am aware. Maybe one to the psychiatric ward. But I think these possibilities should be expanded. More counseling should be available for patients and for medical practitioners as well. In order to promote everything, because in overseas, of course, we see there's a big emphasis and significance given to therapy, but it's not seen over here. Over there in TV series, films, we see they visit the therapist and they like unwind and they let go of their insecurities a bit and deal with things. Over here we are not. We are a bit more Asian. We are bottling up everything, and then at one point it comes to a boiling point, a breaking point, and when that point is reached, well, it's not very good for anyone. So there are no clear mechanisms as far as I have seen in Karapiti, and I hope they will be expanded for our sake and of course for the patient's sake as well. It will be quite nice if that happens in the coming years or decades.
Thank you. Yeah, I think you also mentioned about a very good point, the fact that there are individuals who are being directly referred to the psychiatrist for even minor, mental distress. And some of the clients that even we have been getting, they are individuals who have been using the normal, pharmacological interventions. They have been going through pharmacological interventions and they have been using medication for a long time without any specific, positive effects, and which sometimes psychotherapy definitely helps. So I think that's a very good point that you addressed. And now, with that understanding that we have on how these mechanisms are being implemented in clinical psychology and how these things are being implemented in medicine, let's now talk about how this has been implemented in Ms. Kaushali's, role at her place. What is your take, Ms. Kaushali, on this entire process?
Yes, thank you, Mr. Narayan. And I really want to thank the earlier 2 panelists for bringing this concept up of that we have a bit of a burnout in the system. So if I'm to go back, I think I really varied that point, because in Sri Lankan system, as I said, this connects to the very first observation I said. We do see psychology as a complete different animal. And we do see that it as another, for example, it is maybe a complete different segment which is not involved in humanism. Example like engineering, or example like robotics, that involves our brain to function, but the general psychological interventions or maybe general psychology of life is the way you live. So we seem to be, even though we are a collective society, we seem to have kind of wave away from this. So if I'm to come back to that, to add a bit more to what Dr. Viru was saying, in my view, I think we do have a dissemination of talents, and we are wasting that original time that the clinical psychologists or the doctors can spend on medical segment or the pharmacological segment by burdening them with all the other job roles that they have to play. For example, alternative psychotherapy that we have is also a part that they have to play in-house, because the system has not allowed these engagements, these professions to be recruited, right? Even talking to them, sometimes therapies like talk therapy, or maybe sometimes therapies like drama therapy or music therapy art therapy also is an angle that they have to look into. They have to make themselves aware of it and put some extra effort, whereas that effort, if they were to put on clinical interventions, whereas the severe cases are there, would have been quite ideal and quite supportive, and recognizing their efforts as well. So if I'm to come back to my field where the education is, and mostly I work with young adults and adolescents, the main segment that I would like to pay attention to is the fact that they are informed. So we talk about raising this awareness. Right now, at the same time, while we are raising this awareness, we also need to understand, I believe, that the youngsters, youth, are informed. However, as Sri Lanka, I think what we are lacking is the application of that knowledge and the consistency. Because if you look at any days or any celebrations or any topics, at a very trendy manner, we will be talking about it on those weeks or maybe months of celebrative times. But let's not really, continue to do that talk, continue to raise that awareness throughout. So my personal view is that we are lacking this consistency. And as a result of that, we tend to forget. And we tend to forget the fact that youth is informed and they have the opportunity to make an informed decision. So these are the very important things that I would like to highlight, because of the fact that we do have right for information in Sri Lanka. So we do have opportunity for them to look for information. However, how does that work for application? How good are we as a mother or as a teacher or as a therapeutic personality or any other person? How good are we in actually counting their views? So I think this comes as a part of the collectivism as well. Generally in our families, it's only the mother and the father who mostly get to talk. Kids will have to sit down and listen. So now it seems like a time where, why for a change, why not sit down and listen to them as to what they have to say? So I'm sure they do have that engagement as well in terms of the sector that I am involved in.
Thank you very much, Kaushali. I think that gave us more perspective and insight as to how all of us are dealing with the bigger, issues that mental health practitioners are dealing and how exactly we are taking things forward. Now, with that, I would like to ask from Ms. Yoga about, your opinion on what you think about, implementing a proper system so that it could help your co-workers' mental health concerns. What do you think about this? Currently, are there any specific things that helps your co-workers to deal with their own mental health concerns at your workplace?
So if I want to tell that my present workplace always encourages us to maintain a stable mental health. And they always, sometimes they send some links to watch the videos related to how they to get help, and then how to improve our mental health. So once a month we have staff meetings to discuss about our problems, how we are doing the classes. So if we have any issues, we can approach our management. So it's very helpful. So they always encourage us to work happily. So and then to make the sessions enjoyable to both kids and the teachers also. So recently they introduced some exercising, that which will benefits to the brain before we start each and every classes. So I want to tell you, I'm so lucky to have a nice management like this. So I want to actually appreciate my Ms. Anitra, our management chairperson. So really I have to thank, I'm lucky, we are lucky. So the teachers who are working with in our school, so all are very lucky to have such a nice management. Whatever we have, if we have any problems, we can talk our management. Really the things, whatever the needful things they will do. So finally I wanted to take, this is very helpful, especially for the kids to get their attention every day, so to make our sessions enjoyable and fun. So that's why.
Thank you. Thank you very much. I think that gave us more perspective as to what kind of benefits one could reap when there are proper systems in place where the communication is seriously being taken and when people are being appreciated even during this kind of tough times. ඉතින් ඒකත් එක්ක මම දැන් දැනගන්න කැමති මිස් රිෂ්ණිගෙන් දැන් මානසික ගැටලු කියන එක බහුලව තියෙනවයි කියන එක මේ වෙනකොට දැන් අපිට වැටහෙන දෙයක්. එතකොට දැන් ඔබ රැකියාවේ නිරත වෙලා ඉන්නකොට මේ වගේ දැන් මානසික ගැටලු එහෙම තත්ත්වයන් අපි දකිනවා නම් අනිත් කට්ටියගේ සමහර රෝගයක් නොවෙන්න පුළුවන් නමුත් යම්කිසි ගැටලුකාරී තත්ත්වයක් වෙන්න පුළුවන්. එතකොට ඒ වගේ දේවල් වලින් කෙනෙක්ට අපිට උදව්වක් කරන්න ඕන නම් ඔයා වැඩ කරන තැන එහෙම මොන හරි තියෙනවද මෙකනිසම් එකක් මොන හරි යාන්ත්‍රණයක් තියෙනවද මේක කෝඩිනේට් කරගන්න පුළුවන්?
ඇත්තටම ડોක්ටර් මියුරි කිව්වා වගේ සෞඛ්‍ය සේවය තුළ එහෙම යාන්ත්‍රණයක් නැහැ. මම හිතන්නේ රජයේ සේවය කියන එක ඇතුළෙම එහෙම යාන්ත්‍රණයක් නැහැ. පොඩි උදාහරණයක් අපි ගත්තාම ඕවර්සීස් මොකක් හරි පිටරටක කැම්පස් එකක් ගත්තොත් එතන ඉන්නා ගයිඩන්ස් ඇන්ඩ් කවුන්සලර් කියලා වෙනම කෙනෙක් ඉන්නවා. ළමයිට කියලා කතා කරන්න පුළුවන්. එයාත් එක්ක ප්‍රශ්න කියන්න පුළුවන්. එතකොට දැන් අපේ ආයතනය ජාතික සෞඛ්‍ය විද්‍යායතන වෙලත් එතන ඒ කියන්නේ ළමයින් ට්‍රේන් කරන තැනක් වෙලත් එතන ඇඩල්ට්ස්ලා ඇඩලසන්ට් ඒජ් එකේ ඉන්න අය වෙලත් එයාලට එහෙම තැනක් නැහැ ඇත්තටම. එයාට ගිහලා ප්‍රශ්නයක් කතා කරන්න කෙනෙක් ඒක ඇතුලේ නැහැ. ඒකට එයාලා කරන්නේ මේ ප්‍රශ්නේ අපිත් එක්ක කතා කරන එක තමයි. සමහරක් වෙලාවට ළමයි එන්නේ නැහැ. මේ ප්‍රශ්නේ ඇත්තටම කතා කරන්න එන්නේ නැහැ. මොකද ඇඩල්ට්ස්ලා යාලා ප්‍රයිවසි එක ගැන හිතනවා. එතකොට අපි එතන ප්‍රයිවසි එක මෙයාලා ආරක්ෂා කරයිද කියලා සැකයක් තියෙනවා. මොකද රජයේ සේවයේ වෙන දේවල් එක කල්පනා කරාම ඒගොල්ලෝ ඇත්තට මේකට ෆෝවර්ඩ් වෙන්නේ නැහැ. ඒකට අපේ ආයතනවල එහෙම මුකුත්ම යාන්ත්‍රණයක් නැහැ. ඇත්තටම එහෙම යාන්ත්‍රණයක් තියෙන්න ඕනේ. මොකද අඩුම ගානේ සෙපරේට් කෙනෙක් ඉන්නවා නම් සයිකොලොජිස්ට් කෙනෙක් හරි කවුන්සලර් කෙනෙක් හරි ගොඩාක් ලොකු උදව්වක් වෙනවා ඒ දෙයට. ඉතින් අපි ඒක මිනිස්ට්‍රි එකට දැනුම් දීලා මමත් ගොඩක් ඔය මේ ලියුම් ලියලා එහෙම අපි try කරා ඇත්තටම මෙතෙන්ට එක්කෙනෙක් ගන්න. නමුත් ඒක පොසිටිව් මේ පැත්තක් නැහැ ඒ දෙය. ඇත්තම කිව්වොත් දැන් රාජකාරියට එන්න කියනවා මේ පළාත් සංචලන සීමාවත් එක්ක මම හිතන්නේ වැඩියෙන්ම පීඩාවට පත් වෙලා ඉන්නේ අපි. මම ගාල්ලේ ඉන්නේ. එතකොට කලුතර වැඩ කරන්න යන්න ඕනේ. පළාත් සංචලන සීමා බස් නැහැ. බස් දෙකක් දාලා තියෙනවා. එකක් ප්‍රයිවට් බස් එකක්, එකක් CTV බස් එකක්. ඉතින් මේ බස් දෙක ගහ ගන්නවා. ඇත්තටම වෙලාවක් දීලා තියෙනවා යන්න කියලා. ඒකෝල ඊට කලින් යනවා. ඒකට මේ බස් එක ඇතුලේ ගිහිල්ලා රාජකාරිය කරන්න පුළුවන් නම් මම හිතන්නේ එයා මාර විදියට මානසික වශයෙන් ස්ටේබල් එක්කෙනෙක්. ඒ වගේ තත්ත්වයක් එක තමයි අපිට යන්න වෙලා තියෙන. ඉතින් හරි දුක්ඛිත තත්ත්වයක්. ප්‍රශ්නත් එක්ක ගිහිල්ලා එතන වැඩ කරන්න ඇත්තටම බෑ. යනකොට රතු ඉරි ගහලා එතකොට රජයෙන් චක්‍රලේඛයක් නිකුත් කරලා තියෙනවා ලේඛනයක් පවත්වාගෙන යන්න ඕනේ යන එකයි එන එකයි මේ සටහන් කරන්න විතරයි කියලා. නමුත් එතන ඉන්න අය මොකද කරන්නේ? ඒ ඉන්න සේවකයන් සියලුම දෙනා පාගල දානවා. ඇත්ත කතාව ඒකයි. එතකොට ඒ දේවල් බිම්මට්ටමේ ඉඳන්ම හැදෙන්න ඕනේ ගොඩාක් දේවල් තියෙනවා. ඉතින් හරි අමාරුයි මේ දේවල් වෙනස් කරන්න තනි පුද්ගලයෙක් විදියට.
මම හිතන්නේ ඔයා කිව්වද සෑහෙන්න වැදගත් දෙයක්. මොකද අපේ රටේ දැන් මේ දැන් තියෙන තත්ත්වෙත් එක්ක සංචරණ සීමා දාලා තියෙනවා. එතකොට කොවිඩ් නිසා වෙනත් රෙගුලාසි ඒව දාලා තියෙනවා, නීති දාලා තියෙනවා. එතකොට මේ සියලුම දේට අවනත වෙලා කෙනෙක් රැකියාවටත් යන්න නම් කෙනෙක්ට ප්‍රයිවට් වාහනයක් තියෙන්න ඕන, පෙට්‍රල් ගහන්න පුළුවන් වෙන්න, මේ ඔක්කොම ටික කරන්න පුළුවන් කෙනෙක් වෙන්න ඕන. එන ගමන් කොහේ හරි නතර කරලා කෑමත් කන්න පුළුවන්. යාතියි. ඉතින් ඒක හරි අමාරුයි කරගන්න. එතකොට මට තියෙන ප්‍රශ්නේ තමයි මට රිෂ්ණි කියන්නේ දැන් මේ වගේ වෙලාවක් මේ වගේ තත්වයක් තියෙන වෙලාවට දැන් මුලින් ඉඳන්ම ලොක්ඩවුන් දාපුවාම දැන් වෙනකොට නම් ගොඩක් කට්ටිය ඒක යම්කිසි ප්‍රමාණයකට යූස් වෙලා. නමුත් මේක පළමු වතාවට දාපුවාම ඊට පස්සේ දෙවෙනි වතාවට ආයි මේ වාහම ඔයා දැක්කතු වගේ වැඩ කරන තැන මොනවා හරි මානසික ප්‍රශ්න ඒ වගේ දේවල් වලට මූණ දෙන්න සිදු වෙච්ච කට්ටිය එහෙම සිදු වුණා නම් මොකක්ද එතන ඇත්තට මේ සිද්ධ වුණේ? ඒ කියන්නේ මොන වගේ process එකක්ද එතන ගියේ එතකොට?
අනිවාර්යයෙන්ම එතන අපි ගත්තොත් කොවිඩ් පොසිටිව් වෙච්ච කෙනෙක් කියලා හිතමුකෝ. කොවිඩ් පොසිටිව් වෙලා දැන් අපි හොඳටම දන්නවා කොවිඩ් පොසිටිව් වෙලා දවස් 14 ගිහිල්ලා වැඩට ආවට පස්සේ ඒ කියන්නේ සාමාන්‍ය පුද්ගලයෙකුට නම් ඒක දවස් 21ක් දක්වා දීර්ඝ වෙනවා. නමුත් සෞඛ්‍ය සේවකයෙක් නම් පොසිටිව් වෙලා දවස් 14න් යා වැඩට එන්න ඕන. එයාට මේ දවස් 21ක් ගන්න බෑ. ඒ ඇවිල්ලත් ඒගොල්ලෝ කොන් කරන ස්වභාවයක් මම දැක්කා. ඒ මිනිස්සුත් එක්ක කතා කරන්නේ නැහැ. දැන් අපි හොඳටම දන්නවා යාළගේ ඉන්කියුබේෂන් පීරියඩ් එක ඉවරයි. යාළට ට්‍රාන්ස්මිට් කරන්න බෑ මේ ඩිසීස් එක. තව කෙනෙක්ට දෙන්න බෑ කියලා දැනත් මේ මිනිස්සුත් එක්ක කතා කරන්නේ නැහැ. හරි ඒ මිනිස්සේ දැන් අපේ ඔෆිස් එකේ ඉන්න එක පුද්ගලයෙක් ඉන්නා එයා තමයි ෆයිල්ස් ගෙනihin දෙන්නේ. ඒ මිනිස්සයාගෙන් ඒ ෆයිල් එක අතට ගන්න නැති තත්ත්වයට පත් වෙලා තියෙනවා. එතකොට මම හිතන්නේ මේ මිනිස්සයා කොච්චර ડિප්‍රෙස් වෙනවද? එයා කියන්නේ එයා ගැනම පිළිකුලක් ඇති වෙනවා වගේ දෙයක් තමයි අපිට හිතෙන්නේ. ඒක කොච්චර කිව්වත් සෞඛ්‍ය වෙලත් ඒක හදන්න බෑ. ඒක සෝෂල් ස්ටිග්මා කියන එක ලොකුවටම තියෙනවා. අපි බැලුවොත් HIV patient කෙනෙක් එක මිනිස්සු ඩීල් කරන විදිය තියෙනවානේ. ඒ දේම අපි මේ COVID patient ලගේ දකිනවා. ඒ මිනිස්සුත් එක්ක කතා බහ කරන්නේ නැහැ, කොන් කරලා ඊළඟට යාළව ඒ කියන්නේ ළඟට එනවට කැමති නැහැ. ඒ මිනිස්සයම ඩිසීස් එකක් විදියට දකිනවා. ඒ වගේ ලොකු දුක්ඛිත තත්ත්වයක් පවතිනවා.
මං හිතන්නේ ඒ වගේ තත්ත්වයන් දැන් අපිට අපි කවුන්සලින් කරන කට්ටිය වශයෙන් සයිකෝതെරපි කරන කට්ටිය වශයෙන් ඊට පස්සේ මේ ඇලයිඩ් ඒරියාස් වල ඉන්න කට්ටිය වශයෙන් අපිට මේව ඇත්තට වෙනස් කරන්න පුළුවන් දේවල්. එතකොට මම කැමති ડોક્ટર සදාම්ගෙනුත් අහන්න මේ වගේ තත්ත්වයන් තියෙනකොට දැන් තමා නියැලලා ඉන්න රැකියාවේ ඔබ දැකලා තියෙනවද මේ වගේ තත්ත්වයකට මුහුණ දීපු කට්ටිය හරි නැත්නම් මේවා නිසා මානසික ප්‍රශ්න වලට මානසික ප්‍රශ්න ඇති වෙච්ච කට්ටිය හරි ඔයාගේ එක්ස්පීරියන්ස් එකට අනුව මොනවද මේක සම්බන්ධයෙන් කියන්න පුළුවන්?
ඔව් නරේන් මමත් ගොඩාක් දුරට මේ දේ දැකලා තියෙනවා මගේ ෆීල්ඩ් එකෙත්. මොකද මේ දැන් කොවිඩ් පේෂන්ට් කෙනෙක්ට අනිවාර්යෙන් mental health issues වලට මුහුණ පාන්න වෙනවා. ඒ කියන්නේ ඒගොල්ලන් සමහරවිට ડિප්‍රෙස් වෙනවා, ෆ්‍රස්ට්‍රේට් වෙනවා. සමහරවිට ඒගොල්ලෝ බලාපොරොත්තු වෙන්නේ නැති දේවල් පවා ජීවිතේ මුහුණ දෙන්න වෙනවා. මේ වගේ අවස්ථාවකදී ඩෙත් එකක් වෙන්න පුළුවන්, සෙපරේෂන් එකක් වෙන්න පුළුවන්. ඉතින් ඒ වගේ අවස්ථාවකට පස්සේ අනිවාර්යෙන් මේගොල්ලෝ මෙන්ටලි ගොඩාක් බිමට වැටෙනවා. ඒ අවස්ථාවේදී මම දකිනවා ලංකාවේ තාම අර ස්ටිග්මටයිස් කරන එක. ඒ කියන්නේ ඒගොල්ලන් අපේ රිෂනේ කිව්වා වගේ කොන් කරලා බලන එක. ඒගොල්ලන් මේ කියන්නේ ඒගොල්ලන්ට මොකද්ද ඩිසීස් එකක් තියෙනවා. ඒක සුව වෙන්නෙම නැති ඩිසීස් එකක්. ඒක ඒගොල්ලෝ හැමතිස්සෙම අනිත් අයට ට්‍රාන්ස්ෆෝම් කරන විදිහට තමයි බලන්නේ. ඉතින් මම මගේ හොස්පිටල් එකෙත් ඒ වගේම මම කොලෙජ් එකේ ලෙක්චර් කරන අතරතුරදී මගේ ස්ටුඩන්ට්ස්ලා අතරින්වත් මම දකින දෙයක් තමයි මේ මෙහෙම පේෂන්ට්ස්ලා ඒ කියන්නේ කොවිඩ් පොසිටිව් වෙච්ච කට්ටියව ගොඩක් කොන් කරනවා. ඒ අතින් තව දෙයක් තමයි මම තව දෙයක් දකිනවා මේ ඒගොල්ලන්ට ප්‍රශ්නයක් තියෙනවා වුණත් ඒකට කවුරුත් අර හෙල්ප් කරන්න ඒගොල්ලන්ට මේ අතක් දෙන්න කැමති නැහැ. ඒගොල්ලෝ හිතන්නේ මේ දැන් ඒගොල්ලන්ගේ ප්‍රශ්නේ ඉවරයි. දැන් අපි අපිව බලා ගන්න ඕනේ. අපි අපිව ප්‍රොටෙක්ට් කරන්න ඕනේ. ඒ වගේ මෙන්ටැලිටි එක තමයි ඉන්නේ. දැන් මගෙත් යහළුවෙක් හිටියා. එයා මෙන්ටල් හෙල්ත් ප්‍රොෆෙෂනල් කෙනෙක්. එයා ડોක්ටර් කෙනෙක්. එයාට මේ කොවිඩ් පොසිටිව් වුණා. ඊට පස්සේ එයාට කොවිඩ් පොසිටිව් වෙලා මේ ආවට පස්සේ ආයි හොස්පිටල් එකට ජොයින් වුණාට පස්සේ අපි හැමෝම වගේ කතා කරන්න පටන් ගත්තා. මෙයා මේ ડોක්ටර් කෙනෙක් කියලා එයාටම ඕක හරියට බලා ගන්න බැරි වුණා නේද? එයාටම ඕකෙන් පරිස්සම් වෙලා ඉන්න බැරි වුණා නේද? ඒකට එයාටම බැරි නම් ඉතින් අපි මොනවා කරන්නද? ඉතින් පොඩ්ඩක් අපිත් එයාගෙන් ඩිස්ටන්ස් වෙලා ඉමු. ඒ වගේ දේවල් මගේ කනටත් ඇහෙන්න මේ පටන් ගත්තා. මම ඒකට ඇත්තටම කැමති වුණේ නැහැ. මම එයාත් එක්ක පොඩ්ඩක් සපෝටිව් ඉන්න පටන් ගත්තා. ඒ වුණාට still I also feel that that the stigmatizing is still there. So what we could do is one thing we need to spread a lot of awareness. ඒ කියන්නේ මේ අපි මේ හැමෝම mental health professionals අතරතුරත් මේක ඇත්තටම ස්ප්‍රෙඩ් කරන්න ඕනේ ගොඩක්. ඒගොල්ලන්ගේ ප්‍රශ්නේ කියන්නේ ඉන්කියුබේෂන් පීරියඩ් එකට පස්සේ ඒගොල්ලන්ට මෙහෙම දෙයක් නැහැ. ඔයගොල්ලෝ කරන දේෙන් ඒගොල්ලෝ තවදුරටත් මානසිකව වැටෙනවා. දැන් මේ අවුරුදු දෙකමාරක් කියලා බැලුවා නම් ගොඩාක් patientsලා nearly 54% මම recently දැක්ක statistic වල 54% මේ mental health issues raise වෙලා තියෙනවා anxiety and depression. මේ anxiety depression ආතතිය වැඩි වීමට වැදගත්ම හේතුව මොකක්ද කියලා කිව්වා නම් මේ කොන් කිරීම. तर මේ කොන් කිරීම හින්දා ඒගොල්ලන්ට අර නිසි ලෙස ලබා දෙන්න පුළුවන් facilities health support මේ හැම දෙයක්ම ලැබෙන්නේ නැහැ. ඒකින්ද ඒගොල්ලෝ ගොඩක් deprived වෙලා කියන්නේ සමාජයේ හරිම ආතති තත්යකට පත් වෙලා ඉන්නේ කියන එක මමත් ඇත්තටම දකින දෙයක් තමයි.
Thank you. Thank you very much, Dr. Sadam. And with that, I would like to ask the same question from Dr. Miru as well. What have you noticed in the hospital? Have you noticed this kind of, some sort of like a marginalization when the doctor would actually, contract COVID virus? Have you seen, this kind of things, or have you noticed this kind of things happening inside the hospital systems as well?
Yes, Naren, there is definite marginalization. It's in fact up to a certain level that you develop symptoms of COVID. You have some, cough, sore throat and body aches, this and that. And then some people are still reluctant to test themselves. Sometimes they don't want to do an antigen. They don't want to do a PCR because they get labeled as being COVID positive. So there's that. So what do? They don't come to work mostly. They just don't do the thing. They just stay in quarantine for about 10 or 14 days. They don't like to have that label. they are okay with being in quarantine. හැබැයි කැමති නැහැ COVID-19 වැළඳුනා කියලා කියන්න. So ඒක අනිවාර්යෙන් තියෙනවා. හැබැයි ඒක ඇත්තම කිව්වොත් අපේ එකත් එක්ක මටත් ගොඩක් ලැජ්ජයි. ඒක මේ ડોක්ටර්ස් අතරේ තියෙනවා. අපිට මේක දාන්න මේක ඉන්ෆෙක්ෂස් ඩිසීස් එකක්. අනික මේක මොකක් හරි socially stigmatizing disease එකකුත් නෙමෙයි. වෙන කාට හරි නිකන් ඔය නිකන් මං කියන්නේ ඒක හරි කියලා. කටේ නිකන් බලනවනේ එක diseases දිහා. මේක එහෙම එකක් නෙමෙයි. මේක නිකන් droplets වලින් යන්න පුළුවන් ඉන්ෆෙක්ෂන් එකක්. ඒත් අපේ කට්ටිය ડોක්ටර්ස් අතරේ ගොඩක් තියෙනවා. කට්ටිය කියනවා මේ කරගන්න ඕන නෑ මං quarantine ලා ඉන්න. It has come to that level. So it's very sad actually, despite being educated, despite treating COVID patients, and we write antigens. Sometimes we do the antigen also, but they say they don't want to be labeled as being COVID positive. And one other thing that they mostly say is it's hard to stay in the quarantine period. So because you have like 14 days, you are confined to a room. Sometimes you go to a hotel and say quarantine, or you're at home. So there's nothing to do because you go to work every day and you have interactions with everyone every day. So they say it's hard to stay in quarantine. And I think there should be some method as well for healthcare workers, not only to have some support while in the workplace, but also while in quarantine. Because of course my wife, she also was quarantined. I think about December or so, last year December, she had a significant exposure, and then I had to work. She had to say quarantine in her quarters, and then what she told was there's absolutely nothing to do. So we are very busy. අපිට හිතෙනවා නිකන් නියමයිනේ දවසක් දෙකක් ලීව් හම්බුණා, දවස් පහක් ලීව් හම්බුණා නියමයි ජොලි කියලා. ෆිල්ම් එකක් බලාගෙන හොඳට සින්දුවක් අහගෙන ඉන්න පුළුවන් කියලා. එහෙම නෙමෙයි. ඒක ඇත්තටම මේක ඩිෆරන්ට් දෙයක්. මම quarantine වෙලා නැහැ තාම fortunately. මට symptoms ආවිලත් නැහැ. මේ හැබැයි කට්ටිය කියනවා ඒක තමයි අමාරුම දේ කියලා. ඒක කට්ටියට calls විතරයි ගන්න පුළුවන්. එකට නිකන් ඉඳලා එපා වෙලා වැඩට යන්නත් බෑ, එළියට බහින්නත් බෑ, මුකුත් කරන්නත් බෑ. එතකොට තමයි ඉතින් මේ ගොඩක් කට්ටියට නිකන් work place එකේ stress නැති කට්ටියටත් they got more stress while they were quarantined. They had issues because they call us. Our batchmates when they get quarantined, they call. Sometimes we are free, sometimes we are also busy. So we can't even talk to them and just see how they are and this and that. So that's the issue. The stigma is definitely there. It's up to a level that people don't want to do the antigens and be labeled, but they're happy to quarantine. So ඇත්තටම ඉතින් එකකට දැන් මම ડોක්ටර් කෙනෙක් නේ අපේ ෆීල්ඩ් එකේ ලැජ්ජයි. ඉතින් ගොඩක් කට්ටිය කොහොම බලනකොට අර කලින් ස්පීකර්ස් ලගේ විදිහම තමයි ආපෝ යා ડોක්ටර් කෙනෙක් නේ ආට ඔක තේරෙන්නේ නැද්ද? ඒව තමයි කියන්නේ. Nothing's different. We are all humans.
Yeah, I mean, what you are saying is very true because I was on quarantine like about 2 months ago. And then one of the first things I did was I quickly took a call to my dad and said, like, okay, here's the thing. What am I going to do? Then I was asked to stay at home. And then he kept on saying, you got to definitely go and get yourself tested. So after a few days, I went, not just once, I actually tested myself twice just to make sure that it is not wrong by any chance. Because I think that end of the day is the right thing. But then at the same time, one thing we noticed was the office, kind of got scared because one other person got it before me. And then one of the first things we did was to, to ensure the person like you have nothing to do with this, like it's not your fault. And, things have to be taken forward. And we had to understand it's a virus. I could have, given it to someone else as well, end of the day, if you really think about it. So yeah, so I think that's a very good point that you are making. And with that, I would now like to ask from Ms. Kaushali, what do you have to add to what we have been now discussing here?
Yes, Mr. Naren. I have a bit of a different story, I would say, a positive intervention. So let me start with the university. I am actually engaged in a private university in the capacity of student services and well-being and all those segments coming to play. So when we initially got this, pandemic era coming in not last year, almost like in the beginning of 2020, we were suffering in the same situation for about 6-7 months. But I am very happy to say that what I did was in terms of the engagement, I made few changes and we made sure that we get the support of every single person, regardless of whether they are in the mental well-being profession or whether they're in the medical field or for that matter, into the expertise of the pandemic that was going on. So what we did was we came up with a mechanism where each and every staff member, each and every student in their capacity was getting engaged in different forms. So we came up with this COVID response team. We initiated this among the students. So these are the students in the ages between 15 to 25. So we got them to get engaged and say, okay, assuming that this is going to go for a while, what are your thoughts? What do you want to work on? So we had I think towards the 2020 latter part of the year, we had a massive information drive about about specifically about the disease, and specifically about how are you to overcome that period if you are to cope up with it, especially attending to that 14 days. So with the administration, with the student services, with the faculty members, what we did was we came up with a centralized support system where if a student is actually, or a staff member is actually going through this lockdown period, we made sure there are 14 to 16 people. Every day there's a call. Every day there is an engagement. This is not necessarily for them to, for us to check whether they are doing well, but at the same time to have a different engagement as well. So as a matter of that, we had some students who are purposely calling lecturers who were quarantining with their problems. Right. At the same time, we had some students who were forming new relationships, new friendships with the students who were quarantined that they have never met in the campus. So we came up with 4 or 5 very, planned set of engagements that we have a team of students. Their purpose is to make sure that these people who are going through the quarantine period was engaged. Sometimes they were given trouble, sometimes they were given casual conversations. And we even went to the point of having competitions and engagements, like everything was home-based. So for example, coming up with, gardening projects, coming up with art and sculpture. Right? I mean, you might be seeing some back-end work that I've done on my wall. So it was a matter of, find out the same, the safe place or whatever the place that you have, get yourself engaged and have it shared with the community. So this was towards the end of the 2020, this is what we started. And mind you, I'm very proud to say that as an entity, up to today, we are engaged. And our support structure is working very well, that our online support and for learning support and for the people who are going through quarantine support, all that is in place. And it has supported many students to come up with very nice relationships. They have sometimes not met even as batchmates or maybe even as staff members. So we made sure that even, online events are minimal. It is there. It is not a mandatory engagement for them. But we did have all the other, support structures in place, whereas they could get engaged in different segments. So in the meantime, we also had another support arrangement done, especially for the staff members, because as staff members, up until 2020, we did not have a specific mental health officer that is dedicated, but we came up with that option for staff members as well, as they're working from home. If they have any difficulties, if they have any, regulatory difficulties to catch up. And I want to add to something that, Ms. Rishni was talking about. Yes, it is very difficult when you have those, regulations also pushing you when you're trying to do your work. And the beautiful thing that I would like to share from my point of view is that our university, we removed all those regulations. We made sure that we were telling our staff and students, look, you don't have to really worry about what time you're coming, how are you coming, what is your engagement level, do communicate to us. So if you're thinking you can't make it, do let us know. So we will work with our university members to make sure we have some alternative arrangements when they can't make it. And I want to add that that made a huge difference, Mr. Naren. It made people who are actually stuck to that work frame to go an extra mile and do some support work, especially students, especially the young adults. So that's why I said, all these opinions, the beautiful thing also is that came from students. That's why I initially said it's very nice to listen to the young crowd once in a while, because they come up with amazing solutions. So we just have to sit down as a team and ask students, what do we do now? And that was all suggestions coming from students, and we made sure that we go by that. So that's why I said I have a bit of a different but a positive story that I can share. So we do, as of now, we have a lot of online engagement, a lot of cross-cultural, cross-differential, cross-departmental engagement with students. And of course, we are now looking at expanding it to the next level, going beyond the university itself. So we are currently have started some programs about cultural engagements with different students out of Colombo, right? And we go to the level of, students have they themselves work out on different projects to reach out, not really online, but in different ways. So, and we have introduced pet therapy, engagement of animals, engagement of, music, art therapy. So this is a beautiful thing I said, when we bring in anything other than just psychology and just pharmacology, there's a lot of improvement, and I am one person who is witnessing it, and I'm very happy and humbly proud about it as well, that I was a part of it, engaging as well.
Thank you very much, Kaushali. And I really like that, you told us a very positive story, because what I always say to all my students all the time is that positivity is contagious, just like, coronavirus, like it spreads very quickly, and rest of the people also become very positive. So with that, I would like to ask from Miss Yoga, could you tell us how you being positive and stable can influence your students? How does that impact the students?
So for this, I want to share my own experience. So at the beginning of stage of virtual class, so I got this feeling. So I was focusing on, that means thinking the things that I don't like. That means I can tell you frankly, so I didn't have much basic that I didn't know how to operate to computer, and then I didn't have much knowledge at I think around 2019, 19. So I thought that I have to improve my basic computer skills. I worried about, and then what if I would make mistakes? And I worried about what if I could not do the sessions properly, and what then if I could not be able to start the sessions on time. So I kept on thinking about the negative side. So finally, and then I worried about things, what I can't do. So finally, and then I was attracted by negative thoughts. So gradually, I tried to think positively. So I really think positive, because the quarantine situation made us to develop so many things. For example, instead of worrying about the mistakes what I was going to make, I thought about the good things and the positive things that I was going to make. I stopped thinking about all the bad stuff that I might happen. Then slowly, I gradually, so I thought, so what if I improve my computer skills? And I got excited about what I was going to learn. And then I thought that I would be able to develop basic computer skills. So I built up my confidence, and then I learned gradually with my son's help, and then with my management help. So I proudly say, I feel proud to say that this other good things happened to my life, actually.
Thank you very much. I think that's a very good point that you actually saying, that being confident and how that translates into various other individuals as well. Because those of you who have closely associated me would know that I am a huge advocate of efficacy theories. I tell always how important it is to just keep believing in yourself and pushing yourself. So එතකොට මේකත් එක්ක මට කියන්න ඕන දේ තමයි, දැන් කෙනෙක් ධනාත්මක චින්තන රටාවක් තියෙනවා නම් කෙනෙක් හැමතිස්සෙම තමන්ගේ යම්කිසි ස්ථාවරත්වයක් තියාගන්න උත්සාහ කරනවා නම්, මානසික වශයෙන් යම්කිසි සමතුලිතතාවයක් තමන් කෙරේ තියාගන්න උත්සාහ කරනවා නම්, ඒක ගොඩ වෙලාවට අනිත් පුද්ගලයාට යහපත් විදියට පරිවර්තනයක් වෙන්නත් පුළුවන්, නැත්නම් යම්කිසි අනිත් පුද්ගලයා බලගැන්වීමකට ලක් කරන්නත් පුළුවන් කියන තැන ඉඳන් තමයි මම ගොඩක් වෙලාවට කෙනෙක් එක්ක දේවල් කරනකොට මම දේවල් කරන්නේ. මම කැමති මිස් රිෂ්ටිගෙන් අහන්න, ඔයා වැඩ කරනකොට ඔයාගේ ස්ථාවරත්වය මේන්ටේන් කරනවා නම්, එහෙම නැත්නම් ඔයා බොහොම ධනාත්මක විදිහට හිතලා දැන් මොනතරම් අපි ගැටලු තිබ්බත් රැකියාවට යනවා, ඒ දේවල් කරනවා, ගැටලු කොහොමද निराකරණය කරගන්න උත්සාහ ගන්නවා. ඔයා හිතන විදිහට තමන් මේ කරන පොසිටිව් දේවල් කොහොමද අනිත් ඒ වැඩ කරන කට්ටියට පොසිටිව් විදිහට බලපාන්නේ?
ඇත්තටම අපි පොසිටිව් විදියට හිටියේ නැත්නම්, අපි ඔරවගෙන හිනාවක්වත් නැතුව හිටියේ නැත්නම්, අපිට ඉස්සරහට හම්බෙන මිනිස්සයා පවා ඒකෙන් අයියෝ මේ මොකද්ද මෙයාවනේ උදේම දැක්කේ වගේ ඒ වගේ ෆීලින් එකක් එනවා. සමහර අය ඉන්නවා ඇත්තටම අපි උදේට හම්බෙනකොටත් කැමති නැහැ. ඒකට මම ඇත්තටම මං වැඩ කරන තැන කට්ටිය මට කියන්නේ මං S2කිනුත් hina වෙනවා කියලා. දැන් මං හැමතිස්සෙම hina වෙලා ඉන්න ආස කෙනෙක්. ඒතර අපි මාස්ක් එක දාගෙන ඉන්නේ දැන් කොහොමද පේන්නේ S2නේ. ඉතින් මම අඩුම ගානේ පොඩි දෙයකින් හරි අපිට ඉස්සරහට හම්බ වෙන මිනිස්සයා එක්ක good morning පොඩි දේවල්. ඒ දේවල් වලින් ගොඩක් ලොකු ඉම්පැක්ට් එකක් කරන්න පුළුවන්. ඒ දවස පටන් ගන්න එක. ඒතර අපි අපේ ගෙවල් වල තියෙන ප්‍රශ්න, අපේ තියෙන පෞද්ගලික ප්‍රශ්න අපි රැකියා ස්ථානෙට අරගෙන යනවා කියන එක එච්චර හොඳ දෙයක් නේ. අපි දකිනවා ගොඩක් වෙලාවට සමහර අය ඉන්නවා. ඉතින් මගේම ආයතනයේ ඉන්නවා. ඒ කට්ටිය දැක්කත් අපිට නිකන් අර කිසිම මේ හොඳක් සිද්ධ වෙන්නේ නැහැ වගේ දැනෙනවා. මොකද එයාලා බලන්නේ කොයි වෙලාවෙත් එයාලගේ ගෙවල් වල තියෙන ප්‍රශ්න හින්දා අනිත් මිනිස්සුව පාගලා එයාලව පල්ලෙහාට දාලා කිසිසේත්ම ෆ්‍රෙන්ඩ්ලි විදියකට වැඩක් කරන්න කැමති අය නැහැ. පබ්ලික් හෙල්ත් සෙක්ටර් එක වුණත් අපි මහජනතාවත් එක්කනේ වැඩ කරන්නේ. පබ්ලික් හෙල්ත් කියන්නේ ඒම කොච්චර වුණත් ඒ දේවල් තියෙනවා ගොඩක් ප්‍රශ්න තියෙනවා සමහර අය ඩීල් කරන විදිහත් එක්ක. ඒතකොට මම මගේ ළමයිට කියලා දෙන්න ඔයාලා වැඩ කරන්නේ පේෂන්ට්ලත් එක්ක. ඒතකොට එන මිනිස්සයාට කෑ ගහගත්තොත් ඔයා කෑ ගහනවා නම් මේක හරියට කරගෙන ඉන්න සමහර වෙලාවට එන්නේ පබ්ලික් හෙල්ත් අපි ඇත්තටම රෝග මර්ධනය කියන ඒරියා එකේ අපි මේ ෂේ රෝග පොඩි උදාහරණයක් විදිහට ගත්තා ෂේ රෝග මර්ධන වැඩසටහනේ ඉන්නවා අපේ කට්ටිය. ඒතකොට එයාලා එතෙන්ට එන්නේ ගොඩක් වෙලාවට මේ වයසක අය. එහෙම නැත්නම් ගොඩක් ප්‍රයිවට් තැනකට ගිහිල්ලා ඇෆෝඩ් කරගන්න බැරි මිනිස්සු. එහෙම අය ගොඩාක් දුර ඉඳන් එන අය. ඒ මිනිස්සුන්ට කෑ ගහගත්තොත් ඔයා මේක කරන්න හරියට මෙන්න මේ දේ කරන්න ඇයි මේක මේ විදිහට අරගෙන ආවේ. ඔහොම කියලා කෑ ගැහුවොත් ඒ මිනිස්සු ආයෙත් අපේ සේවාව ගන්න එන්නේ නැහැ. ඉතින් ඔය බේසික් දේවල් ටිකක් අපි අපේ ඇතුලෙන් ගොඩ නගා ගන්න ඕන. එහෙම නැත්නම් මිනිස්සුන්ට කෑ ගහලා ඒ මිනිස්සුන්ව පල්ලෙහාට දාලා අඩුම ගානේ හිනාවක්වත් නැතුව වැඩ කරනවා නම් මං හිතන්නේ කවදාවත් අපි අපේ ජීවිත අපේ ගෝල් එකක් තියෙනවා නම් ඒක සාර්ථක කරගන්න පුළුවන් වෙයි කියලා.
Thank you very much. I would like to ask the same question from Dr. Saddam as well. What exactly happens, like when you are being very positive and how exactly would that translate into the betterment of others?
I think it's a wonderful question, Anand, because I would like to talk about my burnout, what happened during the period I had the burnout and how I overcame that. Actually, during that time, I still remember I was looking for a therapist. In this, I'm talking about European countries. Always I compare because I completed my master's abroad and I did my bachelor's and all the other qualifications I acquired abroad. So I have lived abroad, and all my colleagues, they have their own therapists. They're also practicing as a psychologist, counselors. Even my colleagues and my friends who are living abroad, they have their own therapists. But in Sri Lanka, when I actually look for a therapist, like most of them, they know me, and I'm a famous person in the society. So maybe because of that, they were like really shocked, and they were so amused to think that whether I need counseling. But it was not a very bad thing for me to say it out, because we always try to think about the positive side, and we talk about the positivity and what are the positive things that we face as a psychologist. But we should accept that we are also humans and we are not robots. We have emotions. We undergo negative situations. So I couldn't find a therapist for me yet. Then finally, I have been looking at so many places, and I found out a person who doesn't know much about me, because I thought if that person knows about me, that person will be biased. So I went to her, but I couldn't actually get much of a help. So then I started reading up on burnout, and I started finding so many techniques how I could manage this burnout, because since I started my career, I have never undergone a burnout. This is the first time I have undergone a burnout, unfortunately. So because I used to take lots of precautions to be positive, to let go emotions, and I am a person who starts my day by doing meditations, relaxation, and then I have a morning routine as well where I affirm myself. I really, really love myself, and I encourage all my students and my colleagues also to love their self always, because I'm a very self-loving person. So I used to be very, very self-loving and a positive person. That's how I have been maintaining my mental health for about 10, 11 years. But during this last 1.5 years, I couldn't maintain it because of this COVID, and it was a lockdown. Generally, every week, almost like every week, I used to go for a dinner, or every month I used to go for vacations to keep up my mental health. I talk to my peers, friends, and overseas colleagues and peers to get advice how to maintain my mental health. I've been doing this, but because of this COVID situation, I had a really, a stressful situation. I was into training. I was seeing continuously patients and all that. And during that period only, I realized that what I have been going through for the past 1.5 years because of this pandemic. Then I felt that I was not able to talk to my friends. I was not able to talk to my family. And I literally, I want to be open because I'm not ashamed of talking about this because I overcame it. So I literally hated counseling for about 1 week. It was so difficult. When I got a call from a client, I used to have 90, 50, 90, 100 missed calls from my patients, but I never answered any of the calls because I was so frustrated to that extent. And I was looking for a counselor constantly, a counselor therapist, but I couldn't find it. But then it was so difficult. But at that one point, what happened, one of my colleagues, and he's working as a coach. So he's a very nice person. I spoke to him. And then he's the one who gave me some tips to overcome this situation. I started recalling my past, and I started recalling how I have been handling things well. So then that is when I realized that I need to overcome this somehow by my own because I'm not getting any help. So then I started writing journals. That is the first time I started writing a journal, and it helped me so much. I started, writing my thoughts. I started feeling gratitude toward certain things. I was using a do list, and I was prioritizing, and I was balancing my work life and my family life. And I started using a lot of techniques, and I was able to use these techniques for myself and with my colleagues and peers who are facing the same situation. And I did a lot of awareness programs also related to this. So I also personally feel like your mentality as a mental health professional is very, very much important. If you can't be positive, just imagine if you can't help yourself, how can you help others? I actually thought about it. I actually thought, if I can't help myself at this point, how am I going to help others? That gave me a lot of insight and realization. That's when I was able to overcome. So it was like for about, I would say, 7 to 8 days. It was so difficult. But then I realized this is what is burnout is. And I was so happy to face such an incident in my life because I learned a lot of lessons. Even now I practice. I just keep this with me all the time because I just want to show it. This is my journal. I just love writing it like almost every day. I start my day with the journal and affirmations and all that. I am the person who practice what I preach. But during that time, I actually couldn't practice because I was overwhelmed. But now I would say I have fallen back onto the track and things are going pretty much well. So it's always important as a mental health professional to keep up your mental health by using techniques. Thank you so much.
Yeah, I think what you're saying is very true because end of the day, as I even said in the previous session, like we are not immune to these kind of problems and pretty much like you. So almost every day I have my own set of, affirmations and all those things that I listen to because part of the major therapy that I do is hypnotherapy. So with that, I always use affirmations and things like that. So there is no single day that I would be spending without hypnotizing myself at least for 5 to 10 minutes, which is something that I commonly do just to make sure that I feel good, when I start the day. If not, I would be at least starting my day with some positive music. And I think it is very important that we have things like that so that we are the ones who will be spreading positivity. But at the same time, I think you addressed a very vital point that is, acknowledging the problems that we face as well. Because I always tell even our intern students who are getting the training on how to do counseling and all that, I tell them that if you think you have a weakness, you got to tell it. Then only you would know that you have it and you got to, correct it. And then when an expert shares, like this is something that I had to go through, that gives a larger teaching moment and a opportunity for the youngsters to understand, okay, this is exactly something that we have to use. There needs to be a proper support mechanism. And I think that's very good that you actually brought that up because I think these kind of ideas need to be disseminated to the society and also to aspiring psychologists as well, so that they would know that this would be the right path to take forward. And with that, I would like to ask the same question from Dr. Miru as well, like what he thinks about how he can bring this positive attitude and positivity to people in the wards.
Yeah, positivity, of course. What I tend to now realize is that the previous things that we took for granted, going outside, I'm from Gaul, so going out to Gaul Fort and having your evening or morning round without a mask, right? And not being quite scared about it. So that, because now you are required to wear a mask, even if you are running and you are walking, it's quite hard to run with a mask, of course, as you could imagine. And even the small outings we had, because we generally go out to celebrate some occasions at the ward among us doctors and this and that. So we didn't have that. So it was mostly, take away this and that, having something in the ward, the small gatherings, different regulations. So these little things that we took for granted, and reflecting back on that. And this also led us to, made me think that whatever free time you have away from the ward, you have to make the maximum use of it. Because even sometimes in the ward, the ward is a bit settled and you have nothing much to do and everyone's relatively free. We just think of going out, maybe, just having a nice discussion, sitting in the doctor's room, maybe singing some songs, just having a good time. Because just, looking back, like all these things we took for granted, all the free time we had, the places we went, this and that, traveling. So now I think we are giving more significance for that. Certain things that were actually overlooked and even underlooked, we are giving much more significance to that. And as for dealing with, the certain psychological issues that patients have, I think you all must have seen on the news, all these, concerts, musical, evenings, extravaganza events that are organized in the intermediate care centers for COVID-19 patients. Now, of course, they're coming down, the centers. But previously, doctors used to go there with some bands, some musicians, and they all, just play some music, give them a musical evening. And I think that's a very positive thing. It even happened in the Karapitiya medical faculty, Ruhunu medical faculty, because the students were required to come to their academic, purposes in the hospital while being in the hospital. So they were basically, it's like a biosecure bubble. So they were tested, and the positives, taken for quarantine elsewhere. Negatives were kept in the hospital, and they're required to come to work. So for about a month or two, all these students were there just in the hospital. Even if your house was nearby, you could not go. And so if you're from far away, like Colombo, somewhere you want to, just travel, well, you can certainly forget about it. So the academic staff in the faculty and even doctors, everyone got together and they had some musical evenings, maybe like twice a week or once a week. So those are some things done for the students. And for the wards, of course, you must have seen all these, nurses clad in their PPEs, or even doctors sometimes clad in PPEs, making TikToks and, just getting some music out into the ward and, just having a good time. It's a good time for the patients. And also, I think it's a stress release for the staff as well. Because previously we didn't play music in wards and no one certainly sang songs in the ward. So now I think it adds a bit of more recreation to what we are doing in the wards, and it's actually good. It's a win-win. It's good for the staff. It's good for the patients. And for me, I think it made me give much more value to the good times we had, the free time we had, and makes me, sometimes plan ahead. If I have a free time over here, what am I going to do? I have to, be relaxed over here. Or just I could just sleep it off and just, have the time out. So it made me realize that. And I think this recreation stuff, I hope it will stay, but I doubt, because all these COVID wards are coming down and now they'll be converted back into normal wards. So I hope it stays, but I don't think this recreation will stay anymore. Hopefully it will.
Yes, but that's a very good thing, having that kind of extra things that one could do just to, like have some entertainment as they really put themselves in the front line. So it's a very good thing. So thank you very much for, sharing that. And with that, I would like to ask the same question from Kaushali as well. Like what do you think is, happening in your specific vocation, and how you would be bringing positivity to everyone else around?
Yes, Mr. Naren. So I'd like to answer, it's a beautiful question. I'd like to answer this question in two different angles. First thing is from my perspective, and second thing is from all the way from human perspective. So I personally, for me to be positive, for me to be engaged, three key things that I have been going through in my life. And I'm very thankful for every single negative incident that happened in my life so far, because with that only I started learning these three words. So the very first thing is acceptance. I had massive time, even as a child, even as a youngster, accepting the fact that things can revolve, things can change around, and that minimalistic living is not for me, right? So with the social stigma, with the social engagement, we had this terrible belief that comes into us saying, okay, I have to live like this one, live like that one, or maybe I have to wear somebody like this way, and or maybe I have to walk. There's a lot of pressure that was going on. But with the profession, in fact, with, of course, formal learning, and of course, as I said, the events that were happening in life, one key thing that I started practicing is, okay, acceptance. As much as things will be difficult, it is going to change, and it will also will be coming to another negative state, again a positive state. So when I started getting into this acceptance, things started becoming very easy. Even if I have a complete difficult day where a lot of clients, a lot of therapeutic needs are there, I do think of it, okay, accept it's going to happen. And as much as this is happening right now, it's going to change tomorrow morning. So that was a very good stand that I stood by. And then, of course, the second thing is creativity. So I am someone, even if you're given like one leaf, I would try to think, okay, what can I make out of this? Right? Even if I see a small piece of, wood, or a small piece of something that is just wasted, maybe a bill with something, I would say, okay, what can I do out of this? So this creativity also kept my mind engaged and cutting me off from having to be bored to think of some other angles. So then the last thing was consistency. So in terms of a therapist, I always believe that ethics and consistencies really matter for us. So this whole lockdown period gave me a bit of an extra time to think, okay, where am I missing out my consistency? Even in treating a client, or even if keeping with my responsibilities and my duties as a wife, or maybe as a brother, sister, in my family as a sister, and of course, maybe towards my parents. So I started rethinking towards the consistency, and that also gave me like a very nice platform for me to face this challenge. So that is the very first perspective. If I go to the second perspective, as Dr. Muru and all the other panelists explained beautifully, sometimes nature do give us a very difficult, tough call. And this is the beautiful thing about inculcating alternative creative therapies. Unfortunate thing is, even in the Asia, we still call it alternative therapy, whereas it actually should be inclusive, other perspective-based therapeutic support, right? Dr. Muru was talking about them getting together and singing, right? And then, getting together and having a chat, playing music, right? And also I'm aware of certain other wards where, even if it is psychiatry wards, or maybe with other, clinical wards, where the patients are getting together and drawing, sculpting. These are, maybe they did it, but not being 100% aware that there is a healing process in human beings taking place, other than just having to be relying completely on the psychiatry and psychological interventions. So I really hope and pray Sri Lanka will have acceptance officially, legislatively as well, for these creative therapies-based techniques, which will, allow us to be a human being. And I think for us to start that, this is the call we are getting with the pandemic. People do understand, okay, how pathetically, as Dr. Muru was also very correctly saying, how much of we have been taking things for granted. The precious time of, we right now really value the fact that we can be like this without wearing a mask. And we really value the fact that we can actually sit down and have a conversation, even with the next door neighbor, without having to worry about it, right? So this beautiful, natural, I would say, punishment. Sometimes we need to be punished as a race, right? So I really think it's, even as human engaging, professions, or for that matter, psychological and psychotherapeutic and psychiatric professionals rather, it's time for us to bring this human element out. And if we practice that as a, as a team together, connecting each and every resources, I think we will have an amazing opportunity to overcome this so-called dark cloud, and in a very nice and a very systematic and a very supportive structure, which is not going to collapse again.
Thank you very much, Kaushali. And as we now I think since the start during this 1.5 hours, we discussed multiple aspects pertaining to mental health and pertaining to different jobs that all of you are doing. And now we have a better understanding as to what kind of stresses we are dealing with and how exactly we are overcoming this, and what kind of specific mechanisms need to be introduced. So the real challenge here is getting this into real policy making so that the required things can be implemented. So as we have discussed this, so I would like to ask about, your overall message to, like all our attendees today about, as we celebrate the World Mental Health Day, what would be your overall message? So I would like to first start this by asking from Ms. Yoga about your overall message to all our attendees today.
Yes, as a special needs teacher, now I'm focusing on my kids' happiness, and they have to learn without getting stressed. So I try to get resources through online. Because of this online classes, I have to try to get all the resources through online to make the sessions fun and enjoyable. And then I try to do the things, the lessons more in interesting way. So for example, playing fun games and story time, listening music, dancing for music, to make them fun, to make them happy. So I could feel the happiness through their facial expressions. Then I feel happy during these sessions also. We can do like online classes, like in school, we are doing our level best. So actually, when you talk,
Ms. Yoga, I think you got muted.
Sorry. So this is a special day because of this mental health day. So you have to celebrate that. So if the pain something that is physical, let's say, for example, if someone is having fever, or that is the person is suffering from an injury, that person would be able to express their feeling and seek medical attention one way or another way. However, when it comes to something that is internal, such as mental illness, it is essential that we consider it as an important, and in order to find a solution. That is my opinion. Thank you.
Thank you very much, Ms. Yoga. And I would like to ask from Dr. Sadam as well, what's your message today as we celebrate the World Mental Health Day?
Okay, so on this occasion of Mental Health Awareness Day, I would like to talk about something very, very important, and I would like to give a very strong message to the people, because I always feel like still we are lacking that acceptance in the society for mental health issues and for people who are facing mental health issues. So I would like to state one thing. I want everybody to accept people who are suffering from mental illness and mental health issues, encourage them to express themselves without any kind of a judgment or an inferiority. It's okay to feel anxious. It's okay to feel depressed. It's okay to undergo a burnout, whether you're a professional, whether you're a student, whether you're a mental health practitioner, doctor. Despite the profession, I want everyone to accept those who are facing mental health issues, because we as humans, we undergo emotions, we undergo hard times. As Ms. Kaushi nicely said, the uncertainty. We face uncertainty. Life is not certain. Life is always uncertain, and we have to be ready, and we have to be accepting, and we should not take things for granted. We should appreciate and always feel grateful in life for what we have. So I want every one of us to think from a very positive perspective and accept the people who are undergoing mental health issues, and let them express and come out with their problems, and express their emotions and feelings in a very very freely, in a non-judgmental environment. That is what I want to state. And also I would like to make a request from all the participants. We need to improve the conversation. So join hands to have more awareness programs, have more programs like this, to create that bonding within the professionals, within the mental health practitioners, and the resources and the teachers, whoever is working hard to enlighten this profession. So thank you so much once again for giving me this opportunity. I congratulate Deep Heaven Counseling Center for organizing this, and giving me the opportunity to express my personal experiences, and also to share my views about this particular aspect. Thank you so much, guys.
Yeah, thank you very much, Dr. Saddam, and thank you for actually, taking the time out of your busy schedule to actually come and
My pleasure.
speak with us today. And with that, I would like to ask from Ms. Kaushali, your overall message to all our attendees today.
Yes. So first, let me thank the family of Deep Haven Counseling for having me on board to share these thoughts. Just as much as we all have a thought, it's also important to talk about it, express it, and raise the awareness. So thank you very much for having me on board for this discussion. Having said that, I have one message for everyone who is here and who would be listening out later on. Live life. It's very important that we live life. Living life as a human being involves being scared, involves failing, involves succeeding, involves overwhelming, and involves bad mouthing. All these concepts we talk about are human elements. So you need to have that acceptance. If you're failing, fail, it's fine. If you're succeeding, absorb it, enjoy that moment to the best. And when it comes to your mental health, nothing matters other than just yourself. No point of going and talking to 1,000 therapists or 1,000 support members if your mind says that this is what I want and this is what I want to overcome. So I would really request all of you, as much as you live life, listen to yourself. Everyone, every other incident has given us an opportunity for us to recall our immediate self. Have that self-talk. And if you think you need support, do not hesitate at all to reach out, because regardless of the official structure, regardless of the legislative structures, if you need help, if you need support, we all are there in whatever the way that we can help you out. So enjoy life and have your attributes, have your skills, and have your ethics. These three words have a wonderful, amazing meaning behind that. And if you start thinking, okay, what's my purpose of life? What is my skill for my life? And how can I be happy? The whole common concept of mental health and well-being will be a very nice conversation for all of us. So think about it. It's very, very important for you to have some, food for thought going forward for the next year. Thank you very much.
Thank you. Thank you very much, Kaushali. And with that, I would like to ask from Dr. Miru about his overall message today.
So first and foremost, before I wind up, just thank you so much, Deep Haven Counseling, for providing me this opportunity. And of course, I know you, Naren, from way back. Yes. So as a classmate, as a friend, it makes me very proud to join your session and see where you are. So I'm wishing you all the very best ahead, and I know you'll go from strength to strength. And so I guess for an overall message, it will be, of course, as what Kaushali said before, it's living life. Live life to the fullest. That's what always matters. Taking these little things we took previously as granted, they have massive, massive value. So live life to the fullest. When you're being happy and merrymaking, just, be very happy. And if you have something, going down, just don't just don't go down with it. Sometimes the problem itself is not the problem. It's your attitude towards the problem. So always have that positive attitude, always be good. And just ending this session, ending my part of the session, maybe from one favorite song of mine of Terry Clarkson, I'd like to say, what doesn't kill you always makes you stronger. Thank you, everyone.
Thank you very much, Meeru. And with that, so Vishni, would you like to say your overall message as well?
අපි ලද දෙයින් සතුට වෙනවා නම් අපේ ජීවිතය සාර්ථක කරගන්න එක ගොඩක් ලේසියි. අපි ස්වභාවික පරිසරයත් එක්ක ජීවත් වෙනවා නම් සත්වයකට ආදරය කරන්න අපි දන්නවා නම් මම හිතනවා අපේ තියෙන ගොඩක් ප්‍රශ්න විසඳෙනවා කියලා. එතකොට ආත්මාර්ථකාමී වෙන්නේ නැතුව පරාර්ථකාමී ලෙස ලෝකෙ දකින්න පුළුවන් නම් තමන්ගේ ජීවිතේ ගොඩක් සාර්ථක කරගන්න පුළුවන්. අපිට මොකක් හරි ප්‍රශ්නයක් ආවොත් සයිකොලොජිස්ට් කෙනෙක් ගාවට, කවුන්සලර් කෙනෙක් ගාවට, ડોක්ටර් කෙනෙක් ගාවට යන්න පුළුවන්. එයාලා අපිට මාර්ගයක් පෙන්නනවා. අපි ඩිසයිඩ් කරන්න ඕන අපි මේ මාර්ගේ යනවද? අපි ඊට පස්සේ අපේ ප්‍රශ්න තියෙන ඒවා විසඳ ගන්නවද? එහෙම නැත්නම් අපි තවත් අපේ ප්‍රශ්න වලම එල්බගෙන ඉන්නවද කියන එක. අපිම තමයි අපේ ජීවිතය වෙනස් කරගන්න ඕනේ. 2021 mental health day එකේ theme එක තියෙන්නේ mental health in an unequal world කියන එක. ඒතර ශ්‍රී ලංකා itself an unequal country. අපිට විවිධාකාර ethnics groups ඉන්නවා. ඉතින් එතකොට අපිට බිම් මට්ටමේ සහ අපේ තියෙන මට්ටම ඇත්තටම මානසික සෞඛ්‍ය උපනංවන්න ගොඩක් දේවල් කරන්න පුළුවන්. ඒකට අවස්ථාව ලබා දෙනවා නම් හොඳයි. overall මට කියන්න තියෙන්නේ තමන් ලද දෙයින් සතුට වෙලා කෞශාලි කිව්වා වගේ ජීවත් වෙන්න තියෙනවා නම් ජීවිතේ විඳින්න ඕන විඳවන්නේ නැතුව. Thank you very much, Deep Heaven Counseling. මගේ supervisor Mr. Narayan Selvaratnam මේ අවස්ථාව මට ලබා දුන්නට ගොඩක් ස්තුතියි. හැමෝටම සුබ දවසක්.
Thank you very much. So I think we had overall a very insightful session today, and I really enjoyed the fact that all of you brought in a lot of perspective, gave us a lot of insight, and really taking the dialogue forward, because we could be a very small organization, but still when we take this kind of dialogue forward, it slowly spreads. Just like the coronavirus, just like the positivity that I was saying, even the messages do get spread, it will take some time, but it will definitely, get spread. And the good thing is we can continue to do these kind of things. And I would assume that all of you would share the same sentiments and will stay with us and in these kind of courses. And with that, I would also humbly request, while thanking all of you, couple of more minutes from your time. So we are launching our website of Deep Heaven Counseling today. So I would like to ask Philip to take it forward from here. So thank you very much. And let's now launch the website of Deep Heaven Counseling.
Good evening, everyone. Good evening, sir.
Good evening, Philip.
Is my screen visible?
Yes, it is.
Okay. So good evening, everyone. This is the new Deep Haven Counseling website. And the reason this website has been launched is to make every service provided by Deep Haven Counseling much more easier to the public. As in this website, you will be able to look at every single program provided by Deep Heaven Counseling and the prices and every single the information about the team, and then the services provided. And also to make it easy in terms of booking sessions with regards to counseling also, the website has the feature of online booking. So this is the home page. And on the home page, you will be able to find general information about us and various programs. And at the bottom of the page, you can see our accreditations and our partners. And apart from that, every single event that is going to be done in the near future by Deep Heaven will always be updated here on the website itself. And also all the blogs and articles that the team writes will also be uploaded here, so it can be viewed easily. And then in the next tab, we have information about us. where everyone will be able to find more information, read about our philosophy, our notable work, and also you'll be able to contact us through this easy method where you can put your name in, your email, your phone number, and you can submit it, and then we will be notified, whoever is trying to contact us, and we will get back to the individual trying to contact us as well, as it's much more easier through this method. Afterwards, I want the page on our team. So on this page, you will be able to find all the details about our team at Deep Haven Counseling. So first we have Dr. Selvaratnam, who is one of the members of the Directors Board. And then afterwards we have Mr. Narayan Selvaratnam himself, and Mr. Janaka Samravira, Mr. Samir Ali Jina, Mr. Janush Lawrence, Ms. Amasha Prematilaka, Ms. Yumna Zawahir, and myself, Philip Fernando, and Ms. Sapna da Silva. So here you will be able to find every single detail about our entire team. And on this tab right here, you will be able to find every single detail about all the programs done by Deep Haven Counseling and also CM in Gaul. So here you'll be able to find all kinds of courses which are available online or on site. You have the diploma in psychology, organizational psychology, child psychology, which is all offered through the CM campus. And then you have the PQCP program, which is offered by Deep Haven Counseling. And it has four routes to it as well. And you can find all the details with regards to all these programs over here in terms of the modules, the credits, and the pricing, and the payment structures and the payment plans as well. And finally, we have the page which talks about the services we offer as well. So here you will be able to find all the kinds of services we offer. And this is the area where you can book an appointment. So firstly, suppose you can choose from any of the categories of what kind of counseling or what type of appointment are you looking for. You can choose the service, you can choose the employer you prefer to receive the service from. And then you have all the dates to book, and you can even choose what time to what time you want the session to go on. And then afterwards you can choose the time, you can get the details, you can make the payment here itself as well. And from here you can see all the therapy modalities and the therapists available at Deep Haven Counseling. So this is one of our main features on the website itself, as this makes booking of sessions more accessible and much more easier to the general public, and it's much more efficient in this manner. So this is the new Deep Haven Counseling website, which is launched today. Thank you very much.
Yes, thank you very much, Philip. And so thank you very much once again to all our panelists, especially Kaushali, and then Muru, then Dr. Saddam, and then Rishni, and also Miss Yoga. So thank you very much for taking time out of your busy schedule to come here today and share your thoughts and ideas. And thank you very much for all of that. And so we shall see you again in a similar session just like this. So thank you very much. And I would hope that all of us here today will take these messages forward. So thank you very much once again. And I shall see you all again in a similar session in future. Thank you very much.
Thank you, sir. Goodbye.
Goodbye.
Thank you, Mr. Naren. Bye.
Bye-bye.
Thank you, Mr. Narayan. Kudos to the team.
Bye-bye.
Well done. Thank you so much. See you
Thank
all
you.
later.
Yes, see you.
Thank you so much, sir. Have a nice day.
Yeah, you too. Bye-bye.